Good morning, everyone. So today we're going to have a health presentation based off of COVID and some information that I think is pertinent that we know about because I believe, well, let me show you what I believe. Turn your Bibles with me. We're not going to be looking much at our Bibles today, but we're going to keep in mind that, beloved, I wish above all things that thou mayest prosper in health. But we're actually going to go to Psalms 91. So go in your Bibles to Psalm 91. All right. Psalms 91, and we're going to be reading all the way to, I guess, all the way to verse 9. I'll read, and you can follow. It says, He that dwelleth in the secret place of the Most High shall abide under the shadow of the Almighty. I will say of the Lord, He is my refuge and my fortress. My God, in Him will I trust. Surely He shall deliver thee from the snare of the fowler, and from the noisome pestilence. He shall cover thee with His feathers, and under His wings shalt thou trust. His truth shall be thy shield and buckler. Thou shalt not be afraid for the terror by night, nor the arrow that flieth by day, nor the pestilence that walketh in darkness, nor for destruction that wasteth at noonday. 1,000 shall fall at thy side, and 10,000 at thy right hand, but it shall not come nigh thee. Only with thine eyes shalt thou behold and see the reward of the wicked, because thou hast made the Lord, which is my refuge, even the Most High, thy habitation. So we take that passage. It's a beautiful passage, is it not? Yes, a beautiful passage. And then we turn to the Spirit Prophecy in book 7 Bible commentaries, page 938, and we read, We ask to be kept from the pestilence that walketh in darkness. That is stalking with such power through the world. We are then to cooperate with God, observing the laws of health and life. Having done all that we possibly can, we are to keep asking in faith for health and strength. We are to eat that food which will preserve the health of the body. So God says, yes, we want Psalms 91. We want to be able to be kept from the pestilence that walketh in darkness. But part of doing that is us acting in obedience to laws of life and the laws of health. And so Scripture has promises, but the promises have conditions. We cannot live how we want, do what we want, and expect God's promises to overrun us and overtake us in a positive way. His promises will overtake you and overrun you, but in a negative way. The way of the transgressor is hard. That's the kind of ones that are going to overtake you. But we want it to be overtaken in a positive way, as in Psalms 91. So today we're going to be looking at COVID, because COVID is an interesting scenario that has happened in the world and is happening. So we're told that the devil is playing with the air, and there will be more pestilences. Now, I don't know if I would consider COVID a pestilence, but perhaps some would. But regardless of how you see it or not, because I'm going to be looking at it from a very scientific point of view, the fact is that more airborne problems are coming. And the thing about airborne problems is that they are not limited by borders or by doors or windows. And so it's important that we understand how to meet this, because during COVID, Christians reacted from fear, from ignorance, and from foolishness, for want of a better word. So let's look at this from a point of view of knowledge, faith, to see how we can better prepare ourselves for the pestilences that are coming. So let's go with that. Let me just remember this here. All right. Yes, and remember to pray. This is very important. Sometimes I get so involved in what I'm doing that I forget to pray. By the way, just for announcement for the young people. So I don't need to make for young people. For young and old alike, it's for all of you. Any of you that can repeat Hebrews chapter 1 to chapter 6 by the month of September will be given a gift. So I'm memorizing the book of Hebrews. I'm doing the whole book. So I'm inviting you to join with me in memorizing from chapter 1 of Hebrews all the way to chapter 6 of Hebrews. And if you can recite that, it doesn't matter if you make mistakes or not. That's not what we're looking at, just that you've retained it. You will be given a special gift. So by September, so you have quite a while. You have July, you have August, you have a while to put it to. Don't look at me. You guys need to memorize. This is part of building. This is part of building character. Let's pray. Father, we thank you so much for your love. And as we look at this interesting disease, this interesting time period in Earth's history that is about to be repeated shortly, we pray that we might learn the lessons that we need to, we might understand our bodies the way we need to, so that we might be able to help ourselves, our families, and our neighbors. This is my asking in Jesus' name. Amen. There's a time soon coming when really hospitals are not going to be able to have the answers, and we saw kind of like a taste of that. And so we want to look at it a little bit. Now, it's important for us to understand the immune system. This is a house that you live in, and you need to understand your house. If you understand your house, good for you. If you don't understand your house, then people could lead you into all sorts of directions. Now, from small, you learn certain things about the immune system, and this is just a nice way of doing it. So we have some first responders, like the neutrophils and the macrophages, they're up here. Then we have a cleanup crew. We have trainers and educators. We have cytokines up there. We have a mayor who's a neutrophil. In the middle here, that is covered by this little thingy here, is the message center, which the cytokines are looking after. We have the police and security, which is the regularity T cells. And then we have the army. And the army, they're like, if there's a problem in Guyana, they'll send out the police, but the army doesn't come until things get really bad. Well, the army just disappeared. So it's back. Oh, good. It's like a disappear and come back. All right, we can deal with that. So we have cytotoxic T cells and we have B cells. And these guys, they look after the library and they're memory cells. Now, when something comes into you, let's make something come into you. So we have measles. You all remember measles? Did anybody here have measles? None of y'all never had measles. Look at that. Not you either. All those that were vaccinated against measles. Yes, okay. All those that weren't vaccinated against measles. All right, so a couple people, good. All right, so when the measles comes inside, the first responders come on the line right away, and their job is to see what's going on. They start eating stuff, but they also talk to the cytokines. They talk to this middle structure here, and they say, we need help. And when measles comes in, measles is a respiratory trouble. So you end up having chest troubles, mucus, sore throat, various things happening. But these cleanup crew, they start working. Several people start working, and then they remember the measles. Now, when it comes to a virus or a bacteria or anything, it's like a whole thing, a whole book. So let's say the thing is a whole book. Your body doesn't only remember one page. It remembers all the pages of the book. So if it ever sees even a part of a page that was attached to this book, it'll know in future that it has to kill it. This is very important to remember, right? So our body learned all the pages, and the body says, all right, it attacked the measles disease, and it said, all right, we remember how measles look, and if we see anything that looks like him again, we know what to do because we know how we got rid of it. How long or how fast this takes depends on how well the person has been looking after their immune system. So some people, they'll get infected with something and they'll get over it very, very quickly. Some people, they'll get infected with something and they'll get over it very, very slowly. People that are older, just naturally, the older you get is the closer you are to death. This is just life. So every you reach 60, you're 1 year closer to death. And 61 keeps going all the way, every birthday, 1 year closer to death. So as you're aging, your immune system just naturally gets a little bit old. And for the older people, sometimes it takes them a little bit longer to overcome something. This is just normal aging process. But as it is though, even with the older folks, if they're keeping the laws of life and the immune systems are really high, they can do a good job. But again, it depends on how we're doing in terms of 3 S's. That's what I call them. We talk about them a little bit. Stress, sleep, and sugar. Stress, sleep, and sugar. So every COVID patient that I met, either here in the US, those that had a hard time dealing with COVID were under stress, they were consuming a lot of sugar, or they weren't having sleep, or all of the above. That's just how it worked. All right? So when we move off of it, this is early stage COVID. Now, if I watched pornography once, I watched it on Sunday, and I knew I wasn't supposed to do that, but I did it. When should I pray, ask forgiveness? When should I deal with what happened on Sunday? Sunday night. Sunday, a few seconds after the pornography, I pressed stop. So that sin should be dealt with immediately. Disease 2. So when people first got COVID and the infection came in, it first attacks all these cells. We're going to look at them in a moment, and it enters into the lung. And in the lung, it starts an inflammatory reaction, a cytokine storm. And there's nothing wrong with that. That's the storm to help you heal. The problem is sometimes the storm takes too long. And the longer the storm, so the longer the hurricane, the more the damage. Yes. So with some people, the storm is so long because their immune systems are low, because they're not sleeping, or they're using too much sugar, or they're very stressed. Then they end up having trouble because the COVID causes damage to their arteries. The inflammation is not so much COVID, but what it's causing. It causes damage to the lungs, and the lungs get filled with fluid. The alveoli sacs, this is an empty alveoli sac that can fill with a lot of air. This is one being filled with fluid. And as it fills with fluid, you get more of a because you're trying to breathe, and eventually it becomes so difficult that you'll reach the hospital and you'll want help, which is what happened to quite a few people. The problem with COVID, though, is that people weren't following good medical practice, which is what we can talk about. Good medical practice. So you can't see this right away, but this is the pathophysiology of COVID. There's entry, the activation of the macrophage in the innate immune system, the pro-inflammatory cascade, the cytokine storm. To fix it, it's too long. So then there's lung injury, and then there was respiratory failure. This is how it happened in many people. But we can stop this. You can stop this at home. And this is why we need to look. Now, when we look at the size of particles, because how God has designed us, because we're fearfully and wonderfully made, we're created with that which is necessary to help us to survive attacks from whatever's in the world. And what was interesting is that everything that is part of the innate immune system, so our innate immune system is made up of the creatures on our hand, it's made up of our coughing reflex, it's made up of our sneezing reflex, it's made up of all of the various things that we have to help us to fight naturally. What the medical community did, which was to me at that time just crazy, is that it created protocols to attack each one. And so we want to make sure that we see what they did. But the first thing we're going to do we're going to base it on how particle size. So if you look at very fine beach sand, which is 90 micrometers, then we have a grain of salt, white blood cell comes down, you can't really see some of them, red blood cells, respiratory droplets. Because when you cough or you sneeze, there are virus particles that are by themselves, but it also comes with liquid. It's surrounded by liquid, right? Then dust particles. Dust particles are everywhere and all over the place. Bacterium, very small particle. Wildfire smoke. And then we have coronavirus. Coronavirus is smaller than a particle of wildfire smoke. So I told people very simply, because this was very simple to me, if you could smell smoke, then you weren't protected if there were coronaviruses around. And that makes a lot of sense because smoke can usually go anywhere. So the first thing we were told was put on a mask. And there were several masks around. Any of you still have masks at home? Yes, me too. My mother told me I had a whole box. I was supposed to bring one today, but I forgot. And they said this N95 mask was the best mask. Now, what is to be noted about masks? All masks, even the N95 mask, has 5% of particles that makes it outside of the mask. So it doesn't matter if you have the best well-fitting mask, 5% of particles come out, right? So we continue to look at this idea here. Where am I here? Very good. Now, what happens with the mask is interesting. Because remember I told you that coughing, the ability to use that area, is part of what is supposed to protect us. When you were wearing a mask, say you have COVID. So you're wearing a mask and your body says, cough, because something's irritating you, right? So you start coughing. The mask would trap some of what you breathed out. Some would get out, but some would be trapped in there. And then when you breathe it in, you would breathe back. Yes, you would breathe back quite a bit of material back inside of you, which of course would be a problem because you're not getting rid of what your body naturally wants to get rid of. So this was definitely what you would call an attack on the innate system. The other thing is that when we breathe out, we learned this in primary school. We breathe in oxygen and we breathe out. Now, when you're wearing, this is a properly fitted N95 mask, you will breathe out some carbon dioxide, but you will rebreathe quite a bit of it. So now you can't get rid of the thing that your body's saying cough out. Plus now you're breathing back in the poison that your body was trying to get out. This makes something else worse because as this is happening and you're working all day, the inside of the mask becomes warm, moist, and heated. Now, what grows well in a warm, moist, heated environment? And so it was amazing to me, once again, that what we chose to do was to do this. Now, what's interesting even more is that if you decided to sneeze, because sneezes are so powerful, you guys know sneeze is one of the most powerful things in the world, right? Sneeze is so powerful that it actually blows the mask a little bit off the face so that more COVID particles and other particles come out through the sides of the mask. So we're looking at, again, whether or not these methods were such great methods, and I'm only looking at the mask at this point. So what happened when you sneeze? An excellent fit, but this is not true because 5% comes out in an excellent fit. So when you sneezed, the amount escaping was actually quite large, like 50% of whatever was in you. Who knows who was sneezing behind you in the supermarket? 6 feet apart. We're going to talk about that too in a moment. And so what was troubling We had overweight people, and by the way, the majority of everyone that died during COVID were people that had underlying conditions. So when you go into the hospital, for example, with cancer, cancer is an underlying condition. You start suffering, they're treating you for that. But sometimes what you die of is not the cancer, you die of immediate conditions. So what that means is the underlying condition is cancer, but the immediate condition is that cancer has attacked so many different organs of your body, especially the lungs, and the lungs start having pneumonia. The immediate condition is pneumonia, you're dying from that. The underlying condition that took you to the hospital that has you dying from that is cancer. Usually, when you die, they would write on your autopsy, died of cancer. But during COVID, everybody that had cancer, that died of pneumonia and other lung issues, they wrote, died of COVID, which was interesting. Bless you. That just fit right into there, right? Now, what was interesting though is that we told people that were obese, who were out working, we told them wear a mask, and there were people running with a mask on. So not only are they breathing in back carbon dioxide, they have something going on with them that's a promotion of germs, but because you have the mask, your heart and lungs has to pump more. It puts it under more stress to breathe through the mask. You're running, so the exertion has arisen, and so now these people are being put under duress, so that you actually put them at higher risk of having a heart attack, stroke, asthma attack, or other things to which they were prone, which was a great sadness to me indeed. It got worse because as time went back, they had a Cochrane study, which was a review of many randomized trials that showed very clearly that masks were not statistically relevant in preventing COVID at all. And there were several studies that would come under this. I went to town during COVID and I saw some people doing concrete work. You all know concrete work, you've been doing some at the church. And they were wearing masks. And I remember that Jay and I were somewhere in town, and there was one of the sellers in town. He was pushing a cart. Like they push those cars that have the nuts and so in it. And he was pushing this cart, and the sun was hot. And he is sweating, and he had on a mask. And he was breathing hard. He was breathing so hard, we could hear him breathing hard. And he was putting. I remember Jay telling him, take off the mask, buddy. Breathe. Because if you continue to do that, you will cause problems. But this is what we were told, which to me was fantastic, but it didn't make sense. So if you need to breathe, what you need to do is to remove So if you met people that, if you ever go to anybody and they can't breathe, please tell them, remove their masks. I don't care if you think they're going to kill you. That's all right. Breathe. Breathe. By the way, you as Christians should be immune. Let me repeat that. Remember I read Psalms 91? And Psalms 91 said, you'll be protected from the pestilence that walketh, right? Yeah. And we read from Sister White how we do that, right? Yeah, it's not rocket science. So now on you, on me, on all of us, we have creatures. We have these little creatures, see these little bugs? You're full of the little bugs, and me too. They're my bugs, and my bugs, they like me. I hope your bugs like you. But the bugs are called your holobiome, and they're all over you. And the bugs protect you from germs. So let me give you an example. Come, Samuel. So I don't know what Samuel did. Maybe Samuel picked his nose before. Maybe he was playing with his grandmother and she has something that she shouldn't. I don't know. But at church now, Samuel's going to come and he's going to say, hi, sister, happy Sabbath, happy Sabbath. And creatures from off of him come on to me. Thank you so much, Samuel. I appreciate that. So some of his creatures now come on my hand, and some of his creatures might not be good for me. When my creatures see his creatures, my creatures say, no. You're not supposed to be here. And they will fight and attack and kill all of his creatures. They will say, we don't want them. And I don't know that this process is happening, but it's happening many times a day, as many hands as you shake. However, we were told that what we needed to do was sanitize. We need to sanitize, sanitize, sanitize. The problem with sanitization is that it kills without thinking. So what we were doing, we're killing off our creatures so that we had less creatures, so that when Samuel shakes my hand, I have no defense. And this was another thing that we were told to do. And I could not understand, I still cannot understand why we were told to do things that were harmful to us, but we were. Instead, wash hands, but wash hands with soap. Why is washing hands with soap different? Because when you wash your hands with soap, some of the creatures go on the soap, some of the creatures are washed down, but your hand remains with a lot of creatures. Soap doesn't do the same thing like sanitizer. Trust the soap. Much better to do. Use some soap. Just sanitize, sanitize, sanitize. We kill all the creatures and then we have trouble. Then we were told, very interestingly enough, we were told 6 feet apart. Stand 6 feet. I remember I was in VIP. And VIP, if you've ever been in there, it's a place right, was it diagonally opposite the Keating Market. It's a very small store. So 6 feet apart was hard for us to do. So it was one there, and then they had another one there, and then it was like around the corner, and then they got if you're doing 6 feet, there's only about 4 people could fit in the store one time. And I remember somebody in the store coughed or something, and the other folks in the line, they almost jumped. It's like, you all saw some of that stuff? I remember that stuff. Because we were told so much that 6 feet apart would stop this virus that is smaller than a wildfire smoke particle. Remember I told you that even in a well-fitted N95 mask, at least 5% is out. So if it was me in VIP with 3 other people, that's at least 15% is out in the little store. But it's more than this, because what the CDC said was that the virus can stay. So when the virus comes out, so say 4 people went in the store before me, and 15%, well, 20% of virus particles got in the air. The virus particles don't disappear. They stay there, they settle on stuff, they'll move with the wind. They might go on some of the broccoli, somebody open the fridge. They might land on some of the, cashew nuts. And then that might have gone on all morning. And then I walked in the store and, I'm in there with 3 people and 15%. So by the time I enter the store, about 100% of viral particles are in there. So this idea was really based on nonsense. And I just want to read to you, because the Journal of Clinical Infectious Diseases underscored in their news article that the particles remained airborne. The particles can be carried by air currents. And then the British Medical Journal said that there was no evidence that 6 feet apart was protecting anybody from anything. Well, this kind of thing though continued, because not only were we told that, we were told a very interesting, fascinating thing, that stay indoors. Now, let me just say that one of the greatest minds we were talking about, who was brilliant, Dr. Kellogg, was brilliant. He was wise when he was with the Lord, and then he was brilliant even without the Lord. He was brilliant. How they would handle people with lung disease was that at their sanitarium, they would create what they called tent villages outside of the sanitarium. In other words, he would put people with lung trouble to live outside of the sanitarium in a tent, because he recognized that what they needed more than anything is to be outside, breathing clean air with the sun shining on them. And he would literally put sick people that can't move properly to stay outside. And the tents would be open on all sides, even in the cold air. It was fascinating. But he had very, very good results. In the Philippines, one nurse was telling me that it was always their method to take their patients out outside of the hospital and carry them for walks so that they had fresh air and sunshine. My mom working at Mercy Hospital, that's what they did. Dr. Gomes would have them take patients that were very bad out on the veranda, fresh air and sunlight. But somehow we decided no, if you can't breathe, you need to stay inside and breathe in whatever the air is out there, except in Hong Kong and New York, people in high rises and apartments, they were up top and 10 doors down, 10 floors, 10 floors down was somebody with COVID who was just coughing in their room. And 10 floors up, people were getting COVID inside of the building locked away. How was that happening? The COVID virus moves and it moves through all of the ventilators. So the virus was in all of the chutes connecting all the buildings. So when they locked everybody in, they're actually spreading COVID. But this is what we were told to do, and people follow these things very, very well. Some people were, if you didn't follow what they said, in fact, some people would report you because you were being disobedient and you were putting us and our loved ones at risk. I couldn't believe it, but this is what we were told. Now, in other countries of the world, there were people that were doing the right thing. In the States, in California, Dr. Fareed and I'm going to get the other one's name in a moment, they were having 92% success rates dealing with COVID patients that had underlying issues, because they were addressing the problem right away and they were just doing good medicine. Most people were not. Now, I went in to Woodlands Hospital during COVID, and there was a woman brought in who was having a hard time breathing. She was having such a hard time breathing. And they had her in a gurney and she had a mask. And the woman did this and pulled the mask off of her face. And the nurse put the mask right back on her face like that and said, "Ma'am, you have to keep it on. You have to keep it on." And I said, having the mercy. She couldn't breathe. She was lying on her back. Whenever you have a lung problem, now the things you're learning here are not just for COVID, they're for the flu and cold and pneumonia, for babies, it doesn't matter. You do not put people to lie down on their back in the supine position. You put them in the prone position. They should be lying on their stomach. Why? When you lie down on your back, your mattress, the floor, wherever you're lying down, pushes on the lung. It pushes on the lung so that it reduces the lung capacity. So if you can breathe properly, you can't breathe properly more if you lie on your back. So those in India were making sure that all patients coming in with COVID were placed on their stomachs. Other people, like in Guyana, we were keeping them on their back and keeping them masked because we were just not doing good practice. Now, what's the date up there? July 6, 2026. Now, people believe that this travesty is over, but I repeat to you, the pestilence will get worse and worse, and that which was learned and accepted from COVID will become the norm. A federal court in the States ruled against an Amish family in their religious exemption case. They said that it was not legal for the Amish families to get religious exemption so that their children would not be vaccinated and they could still go to school. This is a precedent. This case is going all the way to the Supreme Court. And depending on what the Supreme Court says, it will affect everybody's ability to get a religious exemption for my body, my choice. And like I said, it's this month. Now, if you think that was alone the case, hold on. Where am I seeing it? Is it there? It's on my thing very clearly. That is the 10th of June, 2026. If you saw the news in Guyana, it says COVID-19 outbreak at 2 schools in Guyana, and they sent everybody home in the 2 schools, and they had the students isolate. Guess where they had them isolate? Inside. We had an interesting to happen in our village because somebody came in and started testing homes one by one for COVID, which should never happen. And I remember they were at the Williams yard and they tested several of them, and according to their tests, we can talk about it in a moment, everybody in the yard had COVID almost. You know how those children were isolating? By playing cricket outside in the street. Best isolation methods ever. They were running with their COVID. playing cricket in the sun, sneezing and chewing together in a wonderful joy, and all of them lived to tell about it, that everything was all right. This was smart. Now, this here is this year too, where the world leaders are going to finalize the pandemic agreement to prevent future global health crises. And in the agreement, they're going to tell you we have to mask, we have to isolate indoors, we have to stay 6 feet away, we have to sanitize, 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 because this was the accepted norm. And these things will cause many people to die. Well, now, of course, they have the AL designed universal vaccine. That means the AI. I call my AI Al. But the AI, the robots have designed the vaccine that apparently is going to save us all. If you believe that, this is this year. Yeah. If you believe that, I don't. So if you look at this, 2002, they said the West Nile virus was going to kill us. In 2004, it was SARS was going to kill us. In 2005, it was bird flu was going to kill us. In 2009, it was swine flu was going to kill us. Then it was Ebola was going to kill us. Then Zika, remember Zika was going to kill us. And then COVID really apparently it killed us. And there's going to be more of the same kind of thing. And the reason for that is because this is called the Hegelian dialectic. It says, you create the problem to get the reaction you want, and then people accept the solution you offer, and if they're really scared, they will beg you for it. And wasn't people doing that? Some people, after the people said you don't have to mask anymore because they realized that stuff wasn't working. Some people said, yes, and y'all should, I can't believe they're lifting these things. We're all gonna die. And we didn't all die, but this was the thought. Now, this is key that I deal with this because this is interesting. So the person that created the PCR test, and I did many PCR tests. I did one here, one in the States, in order to fly. 2 or 3 PCR tests. PCR tests, they were terrible things. They pushed that thing out so far in my nose. I moved away from the stick that the nurse was putting it, where was I? In Woodlands there, and then some lab over in the US. The person that made this PCR test said that it should never be used for testing COVID. Why? The PCR test is designed to test a page of a virus or a bacteria or whatever it is. So remember I told you our body handles the whole book? PCR test deals with a page. But suppose it tests a page that, one, doesn't belong to COVID. Suppose the page looks like the pages of other books. Suppose all of the viruses are history books and COVID looks like the measles, that looks like something, certain of the pages look alike, then that's a false test. Suppose you did have COVID, but your body already healed you from COVID, so you still have a few pages left, then you're testing me and you're saying I'm positive, but I'm already through with COVID. So COVID was really a false scientific test, not COVID, PCR test was a false scientific test that meant nothing. So there were a whole bunch of people that were tested with PCR. They said, you're positive for COVID, you're positive for COVID. They had no symptoms of COVID. They had nothing that said that they were able to give anybody anything. And so this kind of, again, method, to me, it was highly strange, but it is what happened and what will happen again in the treaty that they're putting together to deal with these pathogenic troubles. Then, of course, when you got to the hospital, they were putting people on ventilators. When I was in the US, I was treating several COVID patients, and people were funny because I went by my cousins, and my cousin had COVID, and she was like, I'm going to stay upstairs. You stay downstairs and don't come next to me. And I was walking around like, I'm not afraid of COVID, it's okay. She's like, no, you can't come next to me. And she was like really like isolating herself from me, right? And she had a very bad bout with COVID because she was trying to protect me because she was making me at risk. And I told her, I'm not at risk because, one, if she's upstairs and I'm downstairs, where's COVID? downstairs with me too. So, and so, but again, this is not the ideas that we had. So people were put on ventilators, and the trouble is, COVID patients, most of them didn't need ventilators because they were breathing okay. They had low oxygen saturation levels. So in states, how we deal with disease now, people in the states is very different. So I was going to homes where people had like a whole oxygen task delivered to them, and it was interesting because the people would come, they would put the oxygen task outside, they would ring the bell, and then they would retreat. And then whoever is looking after whomever would come to the door, open the door, and they were dragging the oxygen. And they had to put it together, and there was like a little instruction thing. You call on the phone because people weren't coming to you because all of you were diseased. And so there were quite a few people that had pretty low oxygen saturation. And they didn't seem to be getting well enough. And one of the reasons why is because they were keeping all of these people inside, locked up, without the sun, without the fresh air. I couldn't understand it. And so many of these folks ended up in the hospital where they were placed on ventilators. And the ventilators did not help, and it actually caused their deaths. Tragic, but it happened, and it will happen again. So the idea was, should we vaccinate children? This was a big idea, and we're going to talk about vaccination. Don't worry, I'm going to get you out. I'm going as fast as I can. We're going to get out of here. And Israel was interesting because Israel was one of the first countries that dropped their green pass, and Israel was the first country that had some of the highest vaccination rates in the world. We're going to look at what happened to them in a moment here. Something to know is that doctors were being paid. This is in the US. I don't know what they were paying in Guyana, but doctors, hospitals were being paid. They were being insensitized to vaccinate a number of children. In this case, was 100 vaccinations of children under 2. If you could do 200, the incentive would double. And money, again, the love money is the root of really of all evil. And it's interesting, but a lot of people were cashing in on that. And there was a lot of problems. Now, there were several studies that came out in Israel, in the New England Journal of Medicine 2022, and then systematic reviews and pooled analysis in 2021, that showed natural immunity, when our immune system deals with COVID, is far better than the COVID vaccine. Why? Does that come after? I don't know. Let me see. All right, I'm going to tell you why in a moment. Remind me. Don't make me change. This was an interesting rumor. This is a rumor. I don't know if it's true because Melinda Gates said, yes, her children are vaccinated. The former doctor said no, but we don't have evidence either way. Africa was interesting because Africa said, we don't need all these vaccines. One of the reasons, because Africans in some of those countries, they live close together, right? And so they're like, herd immunity is going to work very well because, you know, I'm here, and in some of the refugee camps, like they got a cloth separating my house from your house. So all of us can get it together, right? And what they were finding, though, is that in Africa, the people were getting immunized by each other, and they were getting over it quickly, and they weren't dying, and they didn't have all these crazy rates. And so it's like, what was going on? And then there was, you know, we need to vaccinate. At this time, something interesting happening because the president of Tanzania, Magufuli, he suddenly died of a heart attack, and the president of Haiti, Moise, he suddenly died of a heart attack. His country has not been the same since. And those two presidents were vehement opponents against vaccines. But that's just a conspiracy theory. And I really am not a conspiracy theorist. So, when they compared SARS natural immunity to vaccine-induced immunity, they found that reinfections was lower with those people that were naturally immune than the people who were vaccinated. Why? We're coming to it. Stay with me. Now, they always had another virus. I can't even remember what was the first variant called? I don't know. But they had, I can't remember. But then they had Omicron. But hold on. April 10th, 2026, they have cicada. You thought the variants were finished? No. We have a new variant now. By the way, they'll continue to get new variants because viruses change all the time. That's why we can't get a cure for HIV because the viruses change all the time. Now, we're continuing. 60 scientists during the time called for an end of the mass vaccination, especially children. And I'm going to read them because there was Kulderf, the professor of medicine from Harvard, Gupta, professor from Oxford, and Bhattacharya, professor from Stanford. They were leading this, but it was a whole bunch of scientists that were saying no, no, no. And the question is, were these people crazy? The Harvard professors and the Oxford professors and the Stanford, were they crazy too? No, they weren't. What they were trying to do is attack this science. Now watch. When you had your measles vaccine, I had a measles vaccine. What they did was they brought in some measles that were weakened. So they were weak measles, they were actual measles, or they were dead measles, a mix in the vaccine. And they vaccinated me, and in came it, and my body looked at those little measles. And my body says, okay, this is what we have to do. We're going to train the first responders. We're going to build our defenses. And they looked at him and they said, yes, this is how we're going to kill it. And then after a while, they remembered everything. Remember how it looked like and said, ha, we're protected together. Measles vaccine worked. I never got measles, but if they see even a page of anything that looks like measles, they will kill it. Now, the difference is COVID. How COVID reacted, because you've never seen a completely purified, the levels of purification of a virus is interesting. There's a whole controversy about that because to purify a virus so that there's no other material under the microscope is actually virtually impossible. In any case, we were told that they had gotten a page called a spike protein, a page. They took this page from COVID. They called it a spike protein. It was just a page. It wasn't a book. They took that page, they put the page in a vaccine. In the vaccine, the page came in, and the page merged with our cells and told our cells to make the page. Let me pause. To tell you how crazy this is. So now your body is making a page from a COVID virus that doesn't belong to your body. Your body is making it. God didn't design your body to make that. You all don't make those things, but this is what the vaccine did. So now you're making the page, which is a whole lot of trouble because when your body sees the page, it's like, that's not our body, that doesn't look like us, and it'll attack that page. But there's another scenario. And then our body saw the pages. It says, okay, we got to learn how to deal with these pages. It learned how to deal with it. It taught each other the pages, and it said, aha, we're protected. We know if we see that page again, we will get it. But Omicron is a new page. Your body didn't learn about that page. Cicada is a new page. Your body didn't learn about that page. So every time there's a new variant, you have no protection. Because all your body was protected from with the vaccine was one page. And that's why natural immunity is so great, because you're protecting against the whole book. But it's worse than that, because now within you, they said it'll only happen at the... Do you need something? What do you need? All right, she's getting it. Now, what they said, this was even interesting, they said, this will only happen at the vaccine site. So in other words, we will vaccinate you here in your hand. Lo and behold, we will put this page, and only in the hand will this page be manufactured. When you're vaccinated and something goes in your blood, where does your blood go? Everywhere. How long is our body now going to be producing this page? Well, they don't know. They never did the studies. They found, though, after that some of the pages were being produced by people's brains because it had passed the brain-blood barrier. So now we're all creating these pages for how long? In which parts? We don't know. Different folks, different strokes. but other people are going to have long COVID. So Israel started to say they were frustrated by the fact that their nation had one of the highest COVID-19 vaccines, with over 60% were fully vaccinated and 25% had the booster, and yet they were leading the world in the daily rate of infections again. Because it was one page, and every other page, you're gonna have to get a new booster shot for every single page. You're gonna be boosted forever. And what was sad is that they were doing this to children. In Guyana, he died. In Guyana, another child died. What was interesting though, this child had anemia, kidney disease, heart attack, but the listed cause of death was COVID. Because they were not putting the underlying disease, they were putting the immediate cause, which was again poor science, did not make sense. More patients were getting worse in the hospital. Why were they getting in the hospital? Now they said it's because the healthcare workers were sick. That might be a factor. But if you dealt with 100 COVID patients and 5% of COVID escaped into the hospital, and then I went there, how much percent of COVID is in the hospital now? 500%. So this wasn't a way to heal anything. Hospitals are hospitals have some of the highest rates of infection and infectious causative agents in the world. It's just, that's what it is. So you need to get out. You need to get out. So over half of the new cases, they call them the breakthrough cases, were found in the vaccinated people. And now my question was, well, then are the vaccinated now become more of a risk to me and my loved ones? I had another question, right? And there were lots of comments going around at this time, and lots of interesting science were happening. Fully vaccinated in people, again, higher risk of infections. People that have been vaccinated have problems up to now because, again, they're still manufacturing a page and they're still having problems. And this continued to be the case. Now, I want to move forward to this here, and I'm almost done because I'll never get through all this information. How deadly was COVID? I can't read down there, so I'm going to read it here. So, first of all, every single cold season, you know, Guyana always has cold season every time it rains. Every rainy season is cold season for Guyana. There's about 30 to 70% of different coronaviruses. And the vast majority of deaths occur in people that are 75 years and older, or if they had underlying conditions, kidney disease, cancer, something like that. The chances of someone under 50 dying from COVID was 0.05%. Teeny tiny. The chances of someone of 18 years old and under dying from COVID without underlying conditions was almost 0%. So why were they being forced vaccinated? By the way, the information is from the Association of American Physicians and Surgeons. Why were everybody being forced to be vaccinated? Vaccinated kids, vaccinated. Why are we? Again, the science was something to be interested in. Now I have 5 minutes to share with you the opposite thing. So I'm going to show you some things that will help you. You need to learn to do all of these things. Let me repeat that again. This is the most important part. If you don't know how to treat COVID, pneumonia, bronchitis, tuberculosis, whatever other osis, whatever else is affecting the lungs, you're going to be at the mercy of bad science, whoever is telling you to do whatever it is, because you're going to be ignorant, you're going to be scared, and you're going to have people dying around you. And I saw that happen whilst I was treating people. I saw people die. People that I saw them one day and they were dead next. Didn't know what to do. Now, anxiety kills. Sorry, I'm looking at my own thing. Anxiety kills. So the more fearful you are, the more COVID, pneumonia, cold, flu, everything is going to attack you. I told you stress is a killer, sugar is a killer, and the lack of sleep is a killer. And it will kill you by almost breaking your immune system in half. So whatever you had to fight is going to be halved by any of those things. You do all of them, your immune system is like, the white blood cells like, we're trying to fight, but they're seeing a virus and they're like, normally they're straight shooters, bah, 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 but they're looking at one, they're like, straight up miss. it's blind. And you're doing that, right? So you can't do that. Now, I'm moving beyond this, Treatment protocols. This is the treatment protocol that worked in the world. So there's a worldly treatment protocol that was being done again by Dr. Fazid and several of them, Dr. McCullough. This is it. Sorry, you can't see clearly, but it's very particular and it works. 92% efficiency rate. But then we have our own methods. And this is what we're going to look at. Wormwood. Wormwood is great. You can get wormwood. You can get wormwood. Go to the store. Y'all know the store? The pharmacy? Not pharmacy. The health store in the ward there. Get yourself some wormwood. If you can't get wormwood, grab bitter herbs. Whatever is bitter. What's bitter? What's bitter bush? Besides Karela. Huh? Neem, besides neem. Pavali, besides that. Go down by Sabro and Border Market and go by one of them people that sell bush and get yourself some bitter bush. That'll work very well. By the way, artemisium was found to be effective at killing COVID in the petri dish. So was Nigella sativa. That's the thing that makes what's the thing that's put in chana or curry? Not jeera. Masala. The thing that makes the masala black, Nigella sativa, the black seed. This was found effective at COVID. I can't read these studies. You guys will just follow me. Elderberry, perfect for COVID. Gooseberry, jamun berry. Get yourself some berries. We got it right in Guyana. Charcoal. Get some charcoal, buy from the store, make sure you have it in your house. It will absorb the viral load. It will remove some of the problem from you with immediate effect. Sunlight. Dr. Rogers Schultz has proven that patients with COVID that are dying, they're dying. The doctors have pretty much given up on them, told them that they had 10 days, spend time with your family. He took those patients outside. It was hard to do because they're hooked up to a lot of tubes and stuff. He took the patients outside in the sun for 15, 20 minutes, and those patients recovered. And the reason for that is infrared and the mitochondria, but I don't have time to talk about that. Vitamin D. All right. This is the truth. Go back. This is the truth. And there are times when your throat will become sore and you're going to have like pustules build up sometimes that are actually very clear if you look at it in there. What you need to do is to know how to deal with that. And this is how you deal with that. You get a sore throat, you feel like you get sick, something going wrong, stop eating. Best method. Stop eating. Stop eating. You will not die. You will live. Stop eating for a day. You will stop a cold. I've done that many times with my own self. Works like a charm. Ice. You can ice a sore throat down. Cold compress, which is what she has on. You put on you get a cloth, dip it in cold water, wrap it around your neck, and then put a dry cloth that can keep in the thing around that completely, sealing it in. It heats up during the night. You can sleep with it. Keep it on in the day, doesn't matter. That's helpful. Alamax, that's something that's very expensive on Amazon, but it works like a charm. It's a garlic extract. Soup is good. Not fish soup, not chicken soup, just edo, cassava, sweet potato, callaloo. Soup is good because minerals don't get destroyed by heating, so it's good for you. Charcoal, zinc or colloidal sprays, a throat lozenge, salt water gargle. Everybody has access to that. Very easy to do. Sinuses. This is called a head cold. When these cavities filled up, see this one is filled, this one is not, that one is filled. When it fills and you say your head congested, you have a head cold, we say in Guyana. What helps with that? This don't help with that. This is another thing. Sometimes you have green mucus. When I was doing that trip in Region 7, when I was with Lisa, Lisa's not from here. She's an American. She's Caucasian. She came and she got really bad lung issues, both she and Kathy at the time. And she started blowing her nose, and the mucus was green. This Lisa almost, Lisa said, I've never seen anything like this in my life. Green mucus? She said, this must be something. This must be something. So I told her, no, a lot of people in Guyana get green mucus. Any of you ever had green mucus? I told her a lot of people in Guyana sometimes get green mucus. It's just the type of bacteria you're exposed to. But she'd never been exposed to it before in her life. She had never felt certain things in her life. She said she never felt this way in her life, the cold yet in her life. I said, well, this here is kind of norm for us. But that's what I believe happens to, like in Africa and Haiti. When COVID came, those people were like, this is kind of normal. We get these kind of things. Everything's okay. And this is good. We were like that in Guyana too once in a time. But now in Guyana, we run to the health clinic and the hospitals much more than we used to, right? So that's the problem. But what you can do for your sinus, inhalation, go and breathe. Go outside and breathe. You can't breathe, go outside and breathe. Breathe in, big breaths. Breathe out, long, until you start coughing. And do it again. That will help you tremendously. Humidifier. If you're living in a place that has AC, get a humidifier. You really need that. Facial contrast baths. That's hot and cold to the face. Keep your head up. Babies, some mothers, their babies have these troubles and they put them to lie down. They have these, Amerindian people walk around with the babies, hold it. The real Amerindians, not the city ones. The real indigenous people in this country. They get cloth or hammock material and they create a wrap like this and they put the baby either here or on their backs and they walk with them for miles. If your baby has a cold, try to do this so that you're keeping the head upright and so that you're going to breathe better. If you put them to lie down at all, it's going to be harder for them to breathe. This is just for moms. The neti cup, you see this girl here? She's using this thing to throw water in one nostril, but the water has herbs inside, like tea tree oil. And it's going through one nostril, coming through the other, because it goes into the sinuses and comes out. Works very well. I've done it myself. It doesn't feel bad. You don't feel like you're drowning, so it's okay. Hot foot bath, sea air. Go, if you could get to the sea, go swimming. You have lung trouble, go swimming. Your nose will automatically start running. You'll clear your things. If you get into the sea water, it's even better. Eustachian tube. This is the one that's connected here and here and here, and you know when something's coming up, and my brothers will start doing this kind of thing. What works well with this? Onion poultice over the ear. Where's the little baby? Yes. So the baby has an onion poultice over the ear. You can do that for children. You can do that for adults. You cut that onion. You can put it in the oven. You can put it in a steam pan for 5 minutes so that it softens a little bit. Put it on the ear and wrap it around and keep it in place. Works very well. Saline water with a bulb syringe. Clean the ear. Clean the ear. Have somebody do it for you. More than easy to be done. In terms of the lungs, treatment of the lungs, because I need to finish here. Treatment of the lungs. Steam inhalation. This works very, very well. You get your pot, make sure the water is nice and hot and bubbling, and you take it off, put it on a table or something, throw in some herbs, or just go and pick the herbs outside the garden, throw in some thyme, some fine leaf thyme, some Suriname thyme, some whatever else that in the garden, neem bush, just throw them into the thing. Get a towel, put it over your thing, put your face over it, bring the towel down so that it's covering the whole pot. Keep your face away from the steam, so you don't want to be burning, but you want to be hot. That's going to open all that up for you. Deep breathing on your poultice, key poultice. You see this incline? Works very good to get stuff out of the lung, or if you got little children, just hold them upside down. Yes, hold them upside down. The lungs will drain that way, and they'll start to cough, and then turn them back outside, and you'll see they start bringing up stuff. Fomentations, posterior drainage. I have one more slide just to show you what that looks like. Learn how to do these things. Fomentations to the back, of the lungs to the front here. This person is in a full fomentation on this area at the back and front. This is one of the best things for helping when you have this kind of trouble, but you have to know how to do it. And we will need to have some classes at some point in time, but at least practice. It's easy. Everybody can do these things, right? So if you know how to do this and you do them well, then you don't have to be afraid of COVID, whatever the next one is going to be called. I don't know, but it's coming. You can be like Psalms 91. You're not afraid by any pestilence that walk in darkness. You're good, you're safe, you have immunity. And God will bless. And He needs us to be able to do that, because if we're sick, who gets to help the unbeliever that is sick as well? If I'm sick and I'm trying to help my neighbor that is sick, that's an unbeliever, then both of us can be at the hospital together dying. Let's not do that. Let's instead be able to keep ourselves well so that we can help the sick. All right, if there are any questions after, you guys can find me if there was anything that was clear. I know I had to go really fast because it's just too much information to cover. But nevertheless, be blessed. Who do I give this to?